have with me Dr. Umair Shah, who is Executive Director of Harris County Public Health. So he is on the ground trying to fight whatever is going on from a public health point of view. So Dr. Shah, first of all, thank you for doing this. My first question to you is that when this pandemic started, of course, it caught everybody off guard. So during the last 2-3 months, what lessons you have learned? Do you think you are more confident now? You are more prepared?
Yeah, Dr. Saleem, thank you first of all for having me. And I think the first thing I would say is that we have been doing and performing and conducting really preparations for pandemic influenza planning for years. Unfortunately, as you know, that we oftentimes get different signals that come through the global sphere of infectious disease activities, which then tell us there is something about to happen, or there's a new outbreak, or there's a new type of disease. Something was a little bit different about this one. I'll be honest, it was right around maybe just between the December holidays, and we were seeing the news that was coming from particularly I remember the New York Times reading something that really talked about this pneumonia, this unexplained pneumonia that was happening in Wuhan. And then we actually, as a department, sent our first alert out to our healthcare system January 9th, and subsequently had a flurry of activities, and then formed our response team January 23rd. And so we were doing informal responses, but when we finally, January 23rd was the date that we actually formed the formalized response team. And at that time, there was a flurry of activity. And the way I look at it is that there were maybe a few phases to this. The first was this, it's not a matter of when, it's not a matter of if, it's a matter of when. And so that there was a lot of monitoring what was happening globally. And then, as you recognize, it went from it's not a matter of when, but it's a matter of now, because not only was it happening in China or in other parts of the world, Asia, Middle East, moving forward, but it was now in Seattle or in Chicago. And then we started to see cases in Texas, particularly repatriated cases who were coming to San Antonio, and then in Houston. And so when it came here, there was a frenzy of activity as we were trying to diagnose and try to meet the first, figure out what the first case was and how to define that. And things were very fast. And then all of a sudden, as we needed time to make sure the healthcare system was ready and that we weren't overrunning the healthcare system, that's when we saw, and so that was that third phase of it, is slowing things down. But then we moved to the next phase, which is obviously where we are now, where we're reopening. And so I think what we've learned a lot in these few months, from January first part to now, end of May, it's been 4 months. And when our department responded to H1N1 in 2009, 2010, our department stood up for 18 months at that time. And as you know, that was a very mild pandemic. So obviously, in the midst of a pandemic that the world has not seen for a century, we're really learning lessons every single day and trying to apply them, almost as what I like to say is, you have plans, but you're also building the plane while you're flying it.
So you mentioned Seattle, and because Washington and California is where it started first. And I remember talking to a family member in March who is in Seattle, and they had about 350 cases, and we had only 5 at that time. Now they appear to be flattening the curve at around 20,000. And as of today, there are about 56,000 cases in Texas. What do you think is causing that upsurge in this state?
Yeah, so a few things are happening. I mean, one, obviously we're the second most populous state in the nation. So obviously when we look at gross numbers, it's not a case rate, it's a total number of cases. Texas has an incredible diversity. You obviously have Dallas and Houston. You have, did I lose you? Are you there? Okay. Dallas and Houston, but you also have Austin, San Antonio, but you also have rural areas, areas across the state where activities are happening as well, and smaller communities where things may be getting there late, or they may not be getting there in the same fashion as they are in the large urban communities such as Houston. I think that's one factor. I think the other is that, you know, we have, there's been a lot of fatigue as we close things down, emotionally, psychologically, sociodemographically, and our community, I don't mean just Houston, Harris County, but I mean our community as the state of Texas, I think has gotten a sense of fatigue. And when that's happened, unfortunately, what does that do? That really gets you to a similar stage where people want to reopen, and they want to reopen, and they want to reopen now. And I think one of the challenges that we have is that it's almost become a binary argument that you can either reopen or you can mind health and safety. And what we've been trying to say is that it's not an either or, it's an and. You can do both together. You can reopen and you can do it safely. But I think the issue is that as we are seeing reopening, the concern in the public health community is that we don't go backwards. That, you know, for example, in Houston, Harris County, we've done a fantastic job as a community fighting this virus, slowing things down. And what we don't want to do, and you've seen some of the images over the last few days, you know, parties or people being in clubs or at restaurants or on beaches, what we don't want to have happen is that there's so much mixing that it curtails all the incredible work that's been done to date. Because whether we do it, you know, we did all these fantastic things months ago or weeks ago, you know, you're always judged by what happens today or what happens tomorrow. And we've got to continue that fight. And I think that complacency is maybe what's riding some of the challenges here in Texas compared to other states, where other states, they still are in a markedly earlier phase because they've you know, had significant amounts of challenges in Seattle or New York or what have you. But in Texas, because we've been able to get past this thus far, I think your concern now is, you know, really very much about reopening related increases in cases, which might be what's happening in some parts of Texas. The other thing I think we have to remember is that complacency also drives people not taking action. And so if they don't wear their facial coverings, if they don't wash their hands, if they don't stay home as much as possible, if they don't social distance 6 feet or more, you have essentially introduced the same type of measure. So if we as a elected body or a public health body or a leadership group say, please do something, it's really dependent on people to do those things. And if they don't, then we're back at it.
You mentioned the either or debate, and there are different models in the world. There is the Sweden model, which is no lockdown, and I wonder if you have seen the article that came out yesterday where a Stanford scientist said that lockdown is not effective. So from a public health standpoint, how do you see this debate? Where do you, which side of it do you stand, and what argument will you give to the people to make them more comfortable with the idea of lockdown, or to get them to kind of adhere to the SOPs that you are giving them?
Well, I think the first thing is that we were very careful not to call it a lockdown or even a shelter in place, because in our community, for example, active shooter events for mass shootings or even hurricanes or chemical incidents, they have a very specific connotation when it comes to what it means to be in a you know, in a shelter in place type of argument or environment, or even in a lockdown type of situation. We don't really want that to be the way we look at this. From our standpoint, really from what we've been trying to say is work from home, be safe, stay at home as much as possible. But I think the Sweden model and some of these other strategies that are out there, and what I would say is, look, everybody in the world right now is trying to understand how best to fight this virus. This is probably the most studied virus in the world. The strategies to fight and slow this virus down are also equally very diverse and numerous in nature. Each strategy has its benefits, it has its pros, its cons, but I do not know of any community in the globe that has been able to fight this effectively. You know, you do get obviously New Zealand, and you hear about what's happened in South Korea. And so again, not to say that there haven't been successful steps, there have been, but I think everybody has had this struggle because it's a novel virus. This is a unique situation for all of us. What I would say is that whether you close things down or whether you reopen or open in the first place, the key is the individual behaviors. And the question is, how do you enact those policy decisions so that individuals are encouraged to follow those behaviors? You can lock a community down, and if people don't want to follow through, they can still privately do all sorts of things that will allow them to continue to be in a scenario where they're going to put themselves or others at risk. You can also open everything up. And if people are following through all those precautions, the likelihood is that you're going to have less transmission. The answer is that we don't know. But I think what I would say is that we have to be very mindful of encouraging steps and behaviors that really allow people to understand the health science. And because there's in distrust of science, evidence, of information, of policymakers, of health officials, of elected officials, then what it does is it encourages people to take chances without any reason except to say, I have the right. And you may have the right, but when you put others at risk, that is an important consideration. And the last thing I would just say about it is think about the scenario of how we even look at seatbelt laws versus driving while intoxicated, right? In America, if you don't wear your seatbelt, you get a fine. It's to protect you. You're going to go through the windshield if you get into an accident. But if you're actually driving while intoxicated, that is also a more serious set of ramifications, even jail time, because it's not just about you, it's about the other person that you might actually endanger. We have to be thinking of COVID-19 in a very similar way. It's not just about protecting myself. I have a responsibility to protect my community.
Okay. If I can segue a little bit, and you might not be able to answer this question in your official capacity, but I'm asking you as a public health professional on the topic of SOPs and lockdowns and all of that stuff. Countries like India and Pakistan, there is this debate whether people will die of poverty and hunger if you keep them in lockdown, and there are congested populations. So how effective a strategy can it be to lock down or to keep them at homes? Because again, not many of them have the luxury of working from home. So what kind of advice will you give to countries like them?
Yeah, and I wish I would have the opportunity to have those kinds of discussions with leaders in Pakistan or India or other countries in South Asia, because that's where I'm from, and so I have an incredible desire to be able to contribute and help. What I would say is that it's very complicated, but I think this is where the secondary impact of decision making has an incredible role to play in the decision itself. And so as governments are making these decisions, they also have to be thinking about how are we going to provide for the residents of our community or for the people of our country if they are locked down, if they are not able to get out, which really means that it's an investment in infrastructure on the social services side. Everything from food to economic or poverty related activities. I mean, this is a very difficult piece, but it's all hands on deck, because what you have to do is you can't just be the Minister of Health that's making those decisions. It's got to be Minister of Health along with a whole cadre of other ministers and other officials who are working together to say, look, this is not just about health. We have to fight the virus. If you die from this virus, you're dead. But we also have to be thinking about the secondary impact of those decisions. What are the things that we have to do to mediate those? What are the things that we have to do to really identify those vulnerabilities and how to then address them? So if that means that we have to really engage the private sector, if that means we have to engage the social welfare sector, if that even means we have to engage the faith sector, you know, our mosques in Pakistan, or you know, the temples in India. I mean, there's incredible community. They're gathering places, but they're also places of community pride, and where communities come together. They're convening places. Those can also be used not just for faith activities, but also to help serve the very people that are now impacted by those socioeconomic ramifications of the health decisions. So I think it's a really complicated question, but you have to bring it all together.
Yeah, so not just the short-term efforts when it comes to fighting the pandemic, but maybe a longer-term policy shift where you bring everything together for social uplift. Uh, Earlier, you mentioned that when you were fighting H1N1, it was an 18-month cycle. So is that the kind of timeline that you're seeing with this pandemic as well?
Well, that's the challenge, right? We don't know. You know, there's obviously a lot of concern that as we get to this, you know, the summer, you know, a lot of people have said, you know, well, maybe this will take a dive because of the warmer weather. And as you know, this is this is a novel virus. It's made a jump from animals to humans. We haven't seen it before. That's why it's novel. But the family of coronaviruses tends to have usually a seasonal variation with the common cold, for example. But SARS and MERS of 2003 and 2013, and even now with COVID-19, we don't know if that seasonal variation is there. We're hopeful, right? We hope that it's there, that it takes a transmission dive. But the truth is, when you look at countries across the globe, Africa included, also in Australia and other places, it has not taken that decrease. And so the concern is that we're going to be in this for a while, that we'll be ping-ponging between closing, opening, closing, opening, or, you know, we're going to do this, and these are activities that we're going to recommend, these are activities we're going to recommend, back and forth, all the way up until the point where you get a vaccine. And the reason the 18 months comes in is that we've already started in January, and we're looking, if you look at 18 months from January of this year, you're looking at summer of next year. That's about the timeline about the vaccine. So we may be ping-ponging back and forth all the way up until the point where we actually get to a vaccine, which will finally, hopefully, get to create immunity for our populations. But again, even there's concern that immunity may be short-lived. And so we just don't know if this is the new normal. And that's, I think, our biggest concern right now as we continue to move forward.
And in that timeline, you have also factored in the threat of the second wave that some experts have mentioned.
Yeah, the second wave is obviously very concerning. The reason it's most concerning is that if you do get a transmission decrease in the summer and it comes back with a vengeance, now maybe the population does not create the immunity that you were hoping for. It's not long lasting, and it's coupled with flu season, influenza in the fall. You have a second wave, which unfortunately could mean that you have more transmission, unfortunately, more overrun of a healthcare system, and certainly complications leading to death. That's the real concern that we have about a second wave.
So my last set of questions to you would be regarding the new normal that you just mentioned. If that is what we are looking at for the foreseeable future, how do you see that impacting businesses when you're trying to reopen? businesses with SOPs. What kind of challenges you think are there?
Yeah, so we've put a lot of guidance on our website, Harris County Public Health's website. I will say that the the way life that we knew it
Mhm.
is not going to at least be back to that way of life for a long time coming.
Mhm.
The fact that you and I are having this interview by virtual could be very different if you're not far from where I am. Normally, you would be coming to my office, or I would be meeting you somewhere, and we would have it in person. Maybe we'd have it over chai.
Yeah.
We would have a samosa or something, and we would be having a discussion in person, right? In fact, our whole culture is about coming together for a number of things. And we talk all the time that health happens where you live, learn, work, worship, and play. So where you live, you come together. Where you learn, you come together. Where you work, you come together. Where you worship, you come together. Where you play, you come together. But COVID-19 has hit us in all of those places, and to fight it, we have to unfortunately be emotionally or spiritually together, but physically apart. So that means that when my kids are being educated, the normal may be that they can't go back to a physical location
Mhm.
for a while, even like next year. That when we're working, the normal may be that half the workforce may not be at the office, it'll be virtual. And businesses will continue to say, what are those decisions that we have to make that will protect our workforce and allow us to continue to do business? But again, I want to stress, Dr. Saleem, the comment earlier, which is it's not an either or, it is an and.
Yeah.
It is possible to have establishments and life go on, but to do it with health in mind. And if we can continue to give the messages that we have given all throughout, even during influenza seasons of past, where we said, wash your hands and make sure you cover your cough, and make sure you don't go around others when you're sick. We've added to that because now we're saying physical distancing. We're saying, wear facial covering. We usually don't say that in the middle of flu season, but if you're sick, we would say don't go out unless you had something on that you didn't, that you had a barrier so you didn't get someone else sick. I think it's impossible for us to do both. So those protocols you're referring to are absolutely essential, because those protocols are what guide the day. If we, as we reopen, for example, or in Pakistan, we're reopening or making decisions, that it doesn't mean that a mosque can't have prayer.
Mhm.
It can have prayer, but it has to be based on two things. One, the leadership of that mosque, making sure all the actions are in place, and the practitioners, the worshipers, also following through with those. If you
Okay.
don't have that,
Got it.
then
Got
we're
it.
cooked.
And you have partially answered my next question regarding educational institutions and how they reopen, because I'm from academia, and the debate is whether we can go back to face-to-face mode after summer. How do you think it will work out, particularly when it is so difficult to social distance in a classroom environment? And if you don't, what kind of risks you run, and more importantly, whether those students and their parents will have trust to send those kids back to school.
Sure. Well, you've seen some images out of China where there's hand washing stations as children enter. There's temperature checks that are happening. Children are out in courtyards where they can spread out. If they're in a classroom, they have even some things on, in the helmets that remind them of the social distancing. Um, there are a number of those kinds of measures that can be done, but I do think that there are other ways to look at it. It's really, at the end of the day, about how to reduce the density,
Mhm.
how to reduce the likelihood that you're going to be right upon someone else. And does that mean that one set of students is on a Monday, Wednesday, Friday schedule, and the other set of students are told you don't come here until Tuesday, Thursday, Saturday, and so you have half the students there so you can socially distance the kids there? I think your point is a good one, which is, at the end of the day, um, education as we know it will be very different. But I will say I have a lot of hope for education, as I do for health and healthcare, because the very people that should be making the most rational, the least emotion-driven decisions should be our healthcare system and should be our educators, our academicians, because ultimately we are driven by decisions that keep reason and rationality. And if we let science drive those decisions, we will get to the ultimate right decision. Unfortunately, it's when politics or emotion get into it that the decisions go from being based on science or health, but based on other things. And the last thing I would say is that, as you know, many times students, when they go to school, it actually relieves a parent from being able to have to, essentially, school becomes a quasi daycare and allows the parent to go to work. So if you don't have those, the ability for a parent to rely on an education system to be able to do that, that has a ripple effect on the business community. So I think it's incumbent on all of us to really think this through and really to get it right. Because if we don't do that, unfortunately, we are in the similar situation that this can actually have ramifications that can have socioeconomic impacts well beyond the education system.
And finally, the question about healthcare itself. There has been a raging debate in this country ever since this started about healthcare being available to everybody, insurance, all of that stuff. The same debate is in other countries as well. So do you think what we are going through has the potential to reshape healthcare for the better going forward?
Yeah, I do. I think we never thought that, we've talked about telehealth and telemedicine, but I don't think we've ever really put it to the test as we did this time. And so COVID-19 has it's been an incredible transformative disruptor of life as we know it. It's also allowed people to slow down and really prioritize, in some sense, what is really important in their lives. And maybe I don't need to be out there for this reason or that, or maybe I don't need to be at work all the time or what have you. So I think medicine has typically been a little bit behind the eight ball when it comes to adopting some of those strategies from a tech standpoint. If you look at healthcare as an industry, it's actually not been as tech savvy as many of the other systems out there. We're late adopters of those. But I do think that this disruption of how life has been for everyone has meant that healthcare has actually really leapfrogged into ways to respond. The reality is that unfortunately, a lot of people have foregone their other healthcare needs, whether it's their diabetes or whether it's their chronic health condition for some other reason, or some other medication that they've needed to get. And so what I always say is, just because you give somebody health insurance or health financing does not mean that somebody is going to be healthier. We have to remind everybody, not just about, I call it the ABCs, not just about awareness, but it's BC, it's the behavior change. And behavior change, as you know, Dr. Saleem, is a science. It's not an easy aspect of it. So what we have to really do, what's that?
Always the hardest.
Always the hardest. And I think the key is that as healthcare systems are coming back, we have to really help the patients, the consumers of those healthcare systems, to really come back as well. The other thing is that we have to remember the important role of public health. And I think this is a really important piece that has highlighted that COVID-19, while it has impact on the healthcare system, and that's actually why we try to flatten the curve and slow the virus down, so you don't get an overrun like you've seen in northern Italy, or you've seen in Wuhan, or seen in New York City. That's when you have bad outcomes, right? That's when you have ventilators not available. That's when you have ICU beds not available. That's when you have an overrun healthcare system. But ultimately, while we're trying to prevent this in the healthcare system, it is a public health crisis. And we have, as a globe, not invested enough in public health. We unfortunately have not invested enough in public health that has really allowed us to remember the prevention mantra. And so I'm hopeful that as we get past this pandemic, and we will eventually get past it, that we have a serious conversation, not just in this country, but across the globe, about what is the investment we want to make, not just in hospitals and doctors and healthcare system, but in true prevention and public health. I'm a physician who's worked in Texas Medical Center for 20, 25 years. I've been an emergency department physician for 20 years. And I'll tell you that I used to think that it would all happen in the hospital, the clinic, or the emergency department, but health happens in the community. And that's where the live, learn, work, worship, and play really comes in to focus. That if we don't have investment in public health and investment in our communities, we ultimately will not just be able to get through a COVID-19 type of pandemic, but we won't be ready for the next emergency that lurks behind the corner.
Mm-hmm. I think that's a good bit of advice for everybody to keep in mind going forward. Thank you so much, Dr. Shah, for doing this. I think you have answered all the questions very extensively. I wish you luck in what you're doing, and hopefully all this will be over soon.
Thank you so much. Thank you for everything you're doing, and thank you for getting the word out in a credible way and not just really emotionally. I really appreciate the fact that, you know, everything that you write about, everything that you honestly have articulate is very much about how do we get through this, but get through this based on reason and rationale. Absolutely. So thank you so much as well.
Thank you so much.